Diabetes is a condition where the body, or to be precise, the pancreas, loses its ability to create insulin, the chemical necessary to regulate blood sugar levels. As we take in food, a substance called glucose enters through the bloodstream, and it is insulin's role to make sure that glucose is carried to different parts of the body. In turn, fuels us with the energy we need. Diabetes is often considered as a silent disease, much like cancer, and nearly 5 out of 10 people are unaware that they have diabetes.
So, how did we get such a disease? A known fact about diabetes is that it can be hereditary, especially if a family member has a history of diabetes. Obesity is also one of the most common factors, leading to the lack of exercise and high blood pressure levels. US studies have shown that diabetes can also develop when a mother gives birth to a child who weighs more than 9 pounds.
There are two types of diabetes. The type 1 diabetes inflicts mostly children when the pancreas completely loses its ability to secrete insulin. Common diabetic symptoms include excessive thirst, frequent urination, and continued weight loss. Despite of excessive hunger, they begin to be insulin dependent, and its dire results may also include blindness and amputation of certain limbs in the body.
Type 2 diabetes is far more common than type 1. Its symptoms may include those of type 1, but its leading concern is that nearly half of diabetics may not be able to have such symptoms, and the cause of hereditary diabetes to children. They are often considered as non-insulin dependents, in which an excessive secretion of insulin passes through the bloodstream, causing the body to develop a high resistance to the chemical. The end result would be the high blood glucose content, which can be treated with regular exercise and a high-protein diet of starch and carbohydrate.
Sadly, there is no absolute cure for diabetes of any type. The only recommendation from doctors is to prolong life, making sure that they will still continue to live normally. In the US alone, nearly 200,000 deaths per year has been reported due to diabetes.
In order to cope with diabetes, it is important to maintain their weight and exercise regularly. Alcohol consumption can be regulated to its utmost maximum, better if cut out completely, and smoking is an absolute health risk to both the lungs and diabetics. Regular visits to the doctor are an absolute must in order to check and make sure that their blood glucose levels are on track. Family encouragement can also do wonders for those suffering from diabetes, helping them that there's always a way to surpass diabetes without the fear of death. It helps increase the quality of life among family members with diabetes.